7 out of 10 American physicians still say they're pessimistic about the future of U.S. healthcare for 3 years straight. And yet, of the physicians who are actually using AI in their practices, 42% are optimistic compared to 20% who aren't. So, for all the health tech founders out there that are building healthcare solutions with AI, are you selling to the 42% or the 20%? Because that difference could be the reason that your product is thriving in one practice, but collecting dust in another. Stick around, because what I'm about to break down in this survey that I just got my hands on, it could completely change the way you think about clinician adoption. Hey, I'm Doree, and in this video, I'm going to break down the 2026 Physician Sentiment Survey from Athena Health's research arm, the Athena Institute. And this data is just too important for health tech founders and executives to ignore. We're going to cover 5 things in this report that you should use to shape your product roadmap, your go-to-market sales strategy, and your customer retention. Let's go. Here's the paradox that's sitting at the center of this whole report. Tech is winning while clinicians stay losing. Now, physician sentiment about their daily work is actually improving. 62% of physicians now say that their EHR makes them more efficient, which is up from 54% just 2 years ago. 42% say AI is actively reducing their administrative burden. And that's real measurable progress right there. And yet, the overall optimism about the future of U.S. healthcare is stuck at a measly 32% for the 3rd year in a row. That means your product may genuinely be helping, and your user still feels terrible about the broader system they're operating in. And I get it. This sentiment matters for how you position your product and how your customer service team engages with providers, and why renewal conversations can feel so hard even when your platform is performing well. So really what it is the clinicians aren't skeptical of you per se, they're just exhausted by everything in the system around them. We need to think about the mindset of physicians based off of how they're feeling about tech and healthcare. There's an actual mindset divide, 2 physicians on different planes. When you understand this sentiment, it explains more clearly how your platform gets used inside a given practice. Think about your current customers. Every panel, clinic, and practice that you sell into has both types. The physician who's comfortable with AI, who becomes your internal champion, actually logs in and gives your customer support team glowing feedback, and the physician who's very skeptical of AI, trained on the old way, and views every new tool as more work, dragging adoption metrics down for the whole group. If your sales team isn't asking about this dynamic during the discovery call or the sales call, and if your onboarding isn't designed to address both of those mindsets, then you're setting yourself up for churn that you should have seen coming. But the divide goes deeper than attitude. It goes by practice size. 65% of physicians at enterprise organizations are comfortable with AI. At small group practices, it drops to 43%. You can also break it down by generation. 65% of millennial doctors are AI comfortable versus 49% of Gen X and boomers. And this is the part that should concern anyone who's selling to independent or small group practices. The clinicians who aren't comfortable with AI are also the ones that are most skeptical about whether new tools will actually help them. They're not necessarily rejecting your product specifically, they're just rejecting the category. And that's an onboarding problem that will not fix itself without intentional design. The next finding in the report is something that's most underappreciated, and it's something that your product leaders need to see. Physicians who struggle with data exchange across EHR systems are dramatically less comfortable with AI across every single use case. 86% of them are uncomfortable using AI for diagnosis support. 83% are uncomfortable with AI for clinical documentation. And 82% don't believe AI is helping to reduce administrative burden at all. These are not coincidences. Trust in technology may be linked to confidence in the completeness and reliability of the underlying data. So if the physician that's using your platform can't get clean, connected information about their patients, then they're not going to trust your AI features either. 73% of physicians say exchanging information across different EHR platforms is still difficult, even after a decade of interoperability mandates. The report also points out that 35 to 45% of all documents that are sent to healthcare facilities are still faxes. What year is it? This infrastructure problem is an upstream of your product. Here's a nuance I don't want you to miss. There's 67% of physicians that say their practice is on solid financial footing. And that sounds fine, but here's the other number. 75% of those same physicians, including many who feel financially stable, worry at least once a year about whether or not they can keep running their practice. So they're stable on paper, but they're shook for real. What's driving that fear isn't what you might expect. 49% of physicians are more concerned about claim denials than declining reimbursement. And for small group practices, that jumps to 66%. Denials aren't just a billing issue. It reflects liquidity, competence, and for small practices, existential issues. The report also found something important about how physicians define financial health. The top drivers are patient loyalty and retention at 59%, patient volume growth at 50%, and payer mix diversity at 47%. So the physicians using your platform are seeing their financial future through the lens of patient engagement, not revenue cycle efficiency. Something else in this survey that I don't want to gloss over is about VBC, value-based care. That section of the report is a quiet objection that's hiding quietly inside of a sales cycle for population health, analytics, and care management companies. 69% of physicians want to learn more about VBC. 55% of them believe it could financially benefit their practice, and nearly half believe it's actually making care better for patients. So the belief is there, but, and there's always a but, only 36% are comfortable with shared risk, where they'd be held financially accountable for patient outcomes. And when you look at what's blocking them, the top barriers are administrative burden and reporting requirements at 43%, uncertain revenue at 31%, and patient engagement and adherence challenges at 29%. The latter is really critical because what that says is that physicians are worried patients won't do their part. If you're selling a care management platform and your pitch is built entirely on outcomes accountability, then you're pitching into a physician population that's already anxious about whether or not patients will follow through, which means that your content and your demos, your patient education, your buyer education need to address that fear directly and not skip over it. All right, product teams, this section is for you. Listen up about what doctors really want. When physicians were asked what would most improve care quality in their practice, they didn't ask for more tools, they asked for better synthesis. The ability to find clinical data easily came in at 54%. Stronger interoperability, 47%. Curated patient charts, 46%. Documentation or scribe support, 45%. And when they were asked what would simplify care delivery, the top 4 items were products that reduce administrative tasks, 50%, electronic prior authorizations, 44%, improved connectivity between systems, 40%, and relevant information that surfaces at the right time, 39%. Notice what is not on that list. We don't see anything about getting more dashboard. Nobody said, send me more notifications. Let's do more patient messages. This report makes it really plain. They're not asking for more tools, they're asking for better synthesis. They want streamlined processes with connected, intelligible information. That's your product brief, that's your positioning brief, and if your current messaging is centered on features instead of synthesis and simplification, then you're speaking a language that your users, these doctors, didn't ask for. So if we zoom out and connect the dots, this isn't on its face just a sentiment survey or a feelings report. It's a strategic brief for every health tech executive who's trying to sell, retain, and grow inside the healthcare system. Physician sentiment is your adoption environment, and right now, that environment has a split personality. They're optimistic about the tech at the task level, but they're very, very deeply pessimistic about the system level, and your product lives in that tension every day. Companies and startups have to understand that they're selling into a burnt-out, fragmented, financially stressed ecosystem and respond by designing their onboarding, customer service, and messaging accordingly. The 2026 data is clear. Your users, the physicians, are not a monolith. They are AI-comfortable champions in your customer base and AI-skeptical resistors in the same practice. And each of these two mindsets have a completely different relationship with your product, your onboarding, and your renewal conversation. So you can't treat them the same. The data infrastructure that your product sits inside matters as much as the product itself. The physicians who struggle with fragmented data reject AI across every use case. If your features depend on clean, connected data and your customers don't have it, then your adoption metrics will never truly reflect the value that you're delivering. Physicians want synthesis, not more volume. They want the right information at the right time with less friction. And that's a UX basic, y'all. If your pitch is adding to their complexity instead of removing it, you're selling against the grain of what every doctor in this survey has been asking for. Drop a comment below. Which of these findings hit closest to home for your company right now? I want to know where you're feeling it most, and if you need help, hit me up. Now, if you want to know more about how AI actually adds more work instead of removing it and what you can do about that, check out this video or this one next.